I now go to Senator Markey.
Thank you, Mr. Chairman. Dr. Monarez, in your testimony, you stated that good public health saves lives, neglected public health costs lives. And you've said here today that rural health is very important to you. Are you familiar with the CDC's Rural Public Health Strategic Plan?
I am not familiar with that.
Well, as part of that plan, CDC established a goal to close healthcare gaps in rural America. Rural hospitals and health centers play an important role in public health programs like making sure that they can get screened for cancer. Dr. Monarez, Republicans are looking to cut over $1 trillion in healthcare, the largest healthcare cuts in U.S. history, as part of their big, ugly bill to pay for tax breaks for billionaires. Take money from the healthcare for ordinary families and give that money then to billionaires. Rural hospitals alone stand to lose at least $70 billion under the House and Senate budget bills. 2 weeks ago, I released data that showed that if the Republicans pass their bill, at least 338 rural hospitals, including 33 hospitals in Louisiana, 35 hospitals in Kentucky, 21 hospitals in Oklahoma, are at risk of closure or cutting services like emergency room care, labor and delivery, or mental health care. And it isn't just hospitals. Nursing homes, community health centers will lose funding because of these cuts. When a rural health center closes, people have to pay more, travel further, wait longer for care. And when a rural hospital closes, people, especially people on Medicaid, die. With unanimous consent, I am submitting this University of North Carolina data into the record, Mr. Chairman.
Objection.
The report on rural hospitals losing $70 billion and 3 studies about the impact of rural hospital closures on health costs and outcomes. Dr. Monarez, do you agree that it is bad for public health, including addressing chronic disease epidemics and infectious disease outbreaks, to close hospitals, nursing homes, and community health centers, and to make it more difficult for people to get health care?
I believe that rural health clinics and federally qualified health centers and critical access hospitals in the rural environment are incredibly important. I care deeply about our rural populations, and I support making sure that they continue to have access to high-quality health care and that they have a workforce that's commensurate with the needs for that population.
I appreciate that, but a vision without funding is an hallucination. If you cut $1 trillion out of the funding, if you cut $70 billion for rural healthcare, you're going to have a problem. You can't provide those services. And my expectation of you is that you're going to speak fairly and honestly to the American people about healthcare cuts on access to care based on your public health experience. And again, let me just lay out the numbers again. 16 million people will lose coverage under the Republican plan. 16 million. Rural hospitals stand to lose $70 billion. Community health centers stand to lose $32 billion. This comes from providing care to the 16 million people who are going to lose their insurance under the Republican plan, and it's going to create a healthcare catastrophe in our country. Ms. Monarez, in 1963, the U.S. Surgeon General, Luther Terry, called the measles vaccine, quote, one of the most significant advances towards decreasing or eliminating one of our most serious childhood diseases. After 40 years, we eliminated measles in the United States. This year, there have been 1,214 cases of measles in just the first 6 months. And we are on track to see the highest number of cases in the United States since we eliminated the disease. Dr. Monarez, do you believe that it is the Secretary of Health and Human Services, Robert F. Kennedy, the Secretary of Health and Human Services, job and responsibility to help stop the measles outbreak?
The Secretary has been very clear of his priority to help stop this measles outbreak, and he has been very clear that the MMR vaccine is a critical component to stopping this outbreak.
Well, your boss, Robert F. Kennedy Jr., fired 17 members of the CDC Advisory Council on Immunization Practices and hired several vaccine skeptics in their place. Lynn Redwood, the former president of the Children's Health Defense, an anti-vaccine organization that Kennedy founded, will present at the CDC Advisory Council on Immunization Practices meeting today. Redwood's presentation includes a study that doesn't even exist about vaccine risk. And in December 2019, Redwood published an article falsely calling the measles vaccine inadequate. With unanimous consent, I will introduce that article, Mr. Chairman, into the record. This is dangerous. Children are getting sick and dying. Secretary Kennedy is giving a platform to people who lie about vaccines to the American people. When Kennedy appeared before this committee, I said I did not want any more tiny coffins in our country. I meant it, and I hope you will be forceful in pushing back against Secretary Kennedy's wrong assessment and messaging on vaccines in our country. Thank you, Mr. Chairman.